Today for our third video, we're going to be going over different types of care and management options for Friedreich's ataxia. While there's currently no cure, your doctor may recommend a variety of different referrals to different specialists in order to help with the care of the different symptoms of this disease. We're going to start first with musculoskeletal and neurologic symptoms, as there tends to be a fair amount of overlap there. For starters, we talked last time about how different patients may have issues with the alignment with their spine or with contractures or other issues with their hands or feet that might make it difficult to walk. For that, your physician might recommend that you see physical and occupational therapy, who are experts in exercises to help with that coordination, as well as different orthotic devices to help with those contractures or with alignment of the spine, as well as possibly different types of walking assist devices such as walkers or wheelchairs for patients who need that. Next, if the issues with the alignment of the spine or with the extremities are significant enough, your doctor might recommend that you see an orthopedist who might have a surgical option to help correct that to a certain extent. We also talked last time about how in a minority of patients you can have issues come up in terms of vision or with hearing. For that, ophthalmology and audiology are the folks you want to see. They can help you with vision correction and also different types of hearing aids to help with those issues. Next on our list, we have speech and swallow therapy. We talked before about those symptoms called dysarthria and dysphagia, which are fancy words for saying difficulty speaking and difficulty swallowing, which have to do with the trouble with coordination that can arise with Friedreich's ataxia. But your speech and swallow therapists are experts in helping with different exercises and techniques to help with those symptoms. Last, we have different types of sleep specialists. Some patients with Friedreich's ataxia have trouble with apnea when they sleep, meaning they have times when they briefly stop breathing, which can really help or make more difficult your quality of life when you sleep. And sleep specialists can help you there. Next, we're going to be going on to cardiac issues. Moving on to care and management of cardiac symptoms, we're going to be looking at some of the screening tools your doctor might recommend, as well as a brief look at some medications that they may or may not decide are right for you. For starters, you might see a cardiologist, or your neurologist might also recommend that you have an EKG, also sometimes known as an ECG, which is a non-intrusive test in order to assess the rhythm and the overall electric function of the heart. It can be done in a couple minutes with just sticking some pads on the chest without any real discomfort. They might also suggest an echocardiogram, sometimes in short called an echo, which takes imaging of the heart structure and its function just using an ultrasound probe, again, completely non-intrusive, just requires a little bit of gel. This is important because sometimes for patients the heart's thickness continues to increase over size, and we need to be able to look and see whether its function is good enough to continue pumping blood in and out appropriately. Next, you might have some ambulatory monitoring similar to an EKG, where it checks the electric signals of the heart, but done over the course of days or sometimes even weeks with pads in order to check and see if there's any abnormal rhythms or other issues with the electric signals of the heart that we might not pick up just from having the EKG done in the doctor's office. Some physicians might also recommend that you have an MRI, which takes a very detailed picture of the heart, although whether or not that's right for you might be up to your physician. Finally, when the heart's function isn't working as well as we'd like, there are different medications that can help reduce the stress on the heart by changing the signaling pathways that the heart uses to regulate itself. We're not going to go into too much depth with these because that's really up to you and your physician to decide if these medications are right for you. But ACE inhibitors and beta blockers are two types of medication that are also used for hypertension that can help reduce that stress upon the heart. While not all patients with Friedreich's ataxia develop diabetes, it's an important enough issue that we should touch on it at least briefly. Both primary care physicians and endocrinologists are capable of managing diabetes, and you'll likely have regular checks to see if your blood glucose is at appropriate levels or not. Blood sugar monitoring can be done in a couple different ways. For patients with Friedreich's ataxia, it's generally done with a glucose tolerance testing, which involves drinking a substance with a large amount of sugar in it and then checking your blood glucose afterwards. Some patients also have their test called a hemoglobin A1C, which is a test to check what your average blood sugar has been over the last couple of months. However, it's usually not as useful in younger patients, and is used in Friedreich's ataxia a little bit less often than just checking the glucose. Next, some patients will require insulin in order to make sure that their blood glucose levels are at a decent level, although some will be able to manage it simply with a combination of diet or exercise. And there are various other types of medications that impact the way your body reacts to the insulin it has. Remember that in Friedreich's ataxia, the issue is that the pancreas often is not able to create enough insulin, which is why you might need to be replaced with artificial insulin that you take. Whereas in other cases, the cells are not able to react to the insulin you have effectively enough and don't bring in that glucose from the blood into the cell itself. Which of these options is right for you is, once again, a conversation for you and your physician. Two more topics that I'd like to briefly discuss are genetic counseling as well as mental health. A genetic counselor is an expert in different types of genetic diseases, including Friedreich's ataxia. For starters, they may have different recommendations in terms of testing to confirm the diagnosis. Remember that in Friedreich's ataxia, the FXN gene, which everyone has, unfortunately has an error, and that there's different types of tests in order to see if there's a problem with that FXN gene. Likewise, you may also have testing done in order to check for the protein frataxin, which is normally made as a result of having a correct version of the FXN gene. If you have enough normal functioning frataxin, then it's pretty unlikely that you have Friedreich's ataxia. They may also discuss with you issues of family planning as well as testing other members of the family in terms of whether or not they might also have Friedreich's ataxia or be a carrier for the disease. We're going to talk a little bit more about the more in-depth issues with the genetics of Friedreich's ataxia in our next video, but just suffice it to say that your genetic counselor might be able to go into a little bit more depth in terms of which family members might want to have testing, as well as any considerations for starting a family on your own if you or your partner have Friedreich's ataxia. Good news is that patients who have Friedreich's ataxia typically have a fairly uneventful pregnancy compared with the rest of the population, and it doesn't seem to affect pregnancy itself that much. Mental health is, of course, an important issue for all patients, and especially with those who face a chronic disease like Friedreich's ataxia, and it's important that patients have the support that they need, especially considering all the stressors that they have, dealing with the different types of management that we've talked about in the symptoms. There are two main broad categories that you might consider for mental health for specialists you might want to see. A psychiatrist is someone who has a medical degree or a DO license and is able to prescribe medications. Whereas a psychologist is someone who specializes in mental health, isn't able to prescribe medications, but quite often is able to spend significantly more time with the patient and spend more time with talk therapy.